Hello and welcome. I'm Michelle Fox with DentistryIQ.com. This week we'll be talking about dental applications of dermal fillers and neurotoxins with one of the co-founders of the American Academy of Facial Cosmetics. If you're attending the Greater New York Dental Meeting, we have a list of new products for you to check out at the meeting. And two doctors discuss the findings of a study regarding oral health care among Hispanics. The co-founders of the American Academy of Facial Cosmetics have taught a full day of courses on facial injectables at the Greater New York Dental Meeting in 2010 and 2011. DentistryIQ.com recently caught up with Dr. Bruce Freund of New Jersey to talk about the growth of using Botox and other facial fillers in dentistry. He estimates that a number of doctors using dermal fillers in dental procedures is low, mainly due to patient perceptions.
I would say, I don't actually have a figure, but I would say that it's actually a lot less than 20%. It's probably more like 5%. And the reason is that the medical community has really started with the dermal fillers and the neurotoxins, and the public has fully accepted the medical community, but they don't realize that the person that knows your face the best is the dentist. The dentist is fully trained in facial cosmetics, and they really are the person that should be doing dermal fillers and neurotoxin.
Dr. Freund also said that dentists are a natural candidate for training in facial injectable classes, even referring to dentists as the needle gunslingers.
I think the only reluctance that a dentist has is the fact that he's used to injecting inside the mouth. He's not used to injecting the face. And once he overcomes that obstacle, as you put it, it becomes a very simple procedure for him, or her, that is. So it's basically just overcoming that obstacle that you're now injecting outside the mouth. Remember, a dentist is not only a dentist, they're also an anesthesiologist. What that means is they have to inject just about every patient they see. So they're injecting all day long. It comes natural to them. And they seem to forget that they are this anesthesiologist as well as a dentist. If you look at a dermatologist, I mean, if it wasn't for facial injectables, how many of their patients are they actually injecting in a day? You know, if you compare it to a dentist is like a gunslinger with a needle, compared to all other professions.
Sounds like Dr. Freund is onto something. Speaking of the Greater New York Dental Meeting, be sure to check out the November issue of Dental Economics, where you'll find a must-see products to see this year in the Big Apple. Inside the November issue of DE, you'll see 32 products that will be on display, as well as the booth number where you can find them. To see the list and to print out as a reference, visit DentistryIQ.com and search for products to see at the Greater New York Dental Meeting. The results of a survey sponsored by Procter & Gamble were discussed at a recent annual Hispanic Dental Association meeting in San Diego. The survey attempted to identify oral health needs of the U.S. Hispanic population. Dr. Sarita Ortega said 3 barriers to oral health care were discovered.
Where the top 3 barriers were knowledge, or really the lack of education, with the emphasis on prevention for the Hispanic community. Also, the second one was access to care, where cost or maybe the lack of dental insurance was one of the issues. And then the third barrier, or really the preference that the Hispanic community shared with us, over a majority of them mentioned that having a Hispanic or a Spanish-speaking dentist who would be able to relate to them was what they preferred.
Dr. Ivan Lugo said identifying misperceptions among Hispanics about oral health care will give the dental community an opportunity to refocus its educational efforts.
What we found of most significant is the fact that the Hispanic community has a perception of their own oral health care that is very similar to the general population. But when we start looking into it a little bit deeper, we find that Hispanics have at least one oral condition in this past year, and that condition is greater than the general population. And then we look even further, and we see that more than 36% of Hispanics have an oral condition that affects their daily lives. So the severity is greater than the general population, and the incidence of disease is greater in the general population, despite the Hispanic population thinking and rating themselves as having good to excellent oral care. So that gives us an opportunity to look at and see that the perception does not match reality. And that translates into an opportunity for teaching and increasing the amount of education at the right population that we need to address. And that will start then begin to change the tide when it comes to oral health literacy of the Hispanic population.
Thank you for that. On behalf of everyone here at dentistyouriq.com, we want to wish all of you a happy Thanksgiving. Thank you so much for joining us on dentistyouriq.com. I'm Michelle Fox, saying goodbye until December 2nd, when we'll return after the holidays.